The evidence is based on a randomised controlled trial of 48 practices in Bristol and Hackney, where we, in half of them, put in place the training and support program and measured identification of women and their referral to specialist services. And what we found was that the program made a substantial difference in identification and referral.
The challenges that we faced in trying to engage clinicians were that domestic violence in itself is a stigmatized topic, and there is research that shows that health professionals struggle with a number of different barriers, including feeling that it isn't their role, feeling that it isn't part of their practice, not being sure about what to do, and not having the training or time to feel confident about how to address it appropriately.
The unique challenges we faced in Hackney are around relationship building. We didn't get the opportunity to build a relationship with City and Hackney Primary Care Trust because they had a lot of staffing changes. So in the Bristol side of the project, the public health lead was consistent and also was really forward-thinking about domestic violence and abuse, so quite on board and always keen to meet and be part of the steering group and look at taking the work forward. I think in City and Hackney as well, things are a little bit different. Often work that's implemented is quite sporadic across different London boroughs. And I think in Bristol they're quite consistent now around domestic violence and abuse. They've got a really good platform.
The advocate educator role is key to the whole project. It's a twofold role. So the educator part is working in the practice with the local clinical lead to provide the training, firstly in the practice to the whole practice team, and then to act as a consultant. And the second part of the role, the advocate part, is as important because this is the role where the patients being referred in are supported, offered choices, supported to create a safety plan. And for many of the patients that were referred, really it's the first time they've had a chance to talk about their experiences.
We've engaged in practices, we've trained GPs, we've formed really good relationships. I think we've both learned a lot about each other, and I think the learning process in itself has made the relationships better. We've both give and take, I think. We understand how GPs work better, we understand some of their constraints.
I think we have done remarkably well, not just in the difference between the control and intervention practices in their behaviour around good practice, but also in clinicians reporting that they have a different attitude to domestic violence, they're much more confident about what to do. Of course, it's the patients that matter, and women who have been reportedly suicidal, despairing, isolated, are now saying because of that change in clinician behaviour, they've received the help that they need.
So I think it's been really successful in forming a bridge between the voluntary sector and primary healthcare. I also think it's been really successful in helping GPs identify and refer patients who otherwise wouldn't have had support. The numbers are really encouraging, and the good thing is that though the research is finished, the referrals keep coming. So that relationship that we've established isn't just based on the research or the pilot, it's actually now, I think, embedded in the way we are practiced and so in the way we relate to each other.
The rollout of IRIS beyond the trial in Bristol and Hackney is part of an implementation program of selling, literally, the model to 12 PCTs, primary care trusts, or new commissioning organisations. With IRIS, we thought that since we really did have a successful study and we showed that we could make a difference, that we needed to then take it to the next step, which was trying to get this mainstream within the NHS nationally. And we're grateful to the Health Foundation for saying, yes, we support you in doing that, because from their point of view, investing in research isn't that useful unless they can show it's made some kind of impact.